Welcome to the Scaleup Valley podcast, where we bring the best of the best to help you scale your business from 1 million to 1 trillion. Today's guest is a very special one. Her name is Kathy, the CEO of HerMD. Kathy, welcome to the show.
Well, thank you. Thank you, Mike. It's a pleasure to be here.
Likewise, and I'm sure that we'll have a lot of fun, and the audience will learn a ton from you. And but let's get to know more about you and why did you decide to start up HerMD?
Well, Dr. Javed, Somi Javed, started HerMD, and she was an OBGYN who was seeing 50 patients a day and realized that she couldn't serve the patients in the way that she wanted to serve them. And so she started HerMD. She's been growing the company over the last, I would say, 7 years, and just recently took on some funding, and that's how I came into the picture.
Got it.
So, part of that process was to hire a CEO, and I got a call from a recruiter, and it was when they described what HerMD was doing, I was just hooked right away on the mission of the company to help women.
I love it. So, and share with us a little bit more about the story of the company and what is the vision of the company.
Absolutely. So HerMD is really focused on providing women exceptional health care. And we focus primarily in areas of sexual health and menopause, which are often overlooked by your traditional healthcare providers. They just don't have the time or the training to help women in an effective way with these issues. And so that's really, I think, the main focus of what we're offering to our patients is expertise in that area.
Got it. Sounds great. And what would be the big dream, like let's say the long-term vision? What needs to happen in order to feel that HerMD has been able to fulfill the mission of HerMD?
Well, we would like to be in every state in the country. I mean, that's really what we want to do, is to expand across the nation to do what we're doing in Kentucky and Cincinnati on a much broader scale. And so that's really our North Star, is to try to serve women all over the country and beyond. We have patients coming in from Canada as well on a regular basis.
Got it. Sounds great. Of course, there is something really important about your concept, which is to treating women in a different way and providing a kind of care that they are not able to have in the traditional healthcare system. So, and all about this is, of course, the mission, the brand, the community, what you are trying to build. Can you share a little bit more about what is kind of the special ingredients that you are trying to bring with the brand and the community?
I think maybe I'll give you an example of when I joined the company. I came from a healthcare organization where we did 15-minute visits. And when Dr. Javed said, well, we start every new patient with a 60-minute visit, I thought, wow, like, what would you even do for an hour? And so I said, I'd like to be a patient. I'm a menopause age woman. I want to do a real visit, and I have real issues just like everyone else. And what was really different about that visit is, first of all, there was no computer in the room. No one was standing at the door with their hand on the doorknob. And she listened and asked a lot of questions, and we used a full 60 minutes. And I felt like at the end of that visit, not only did my provider understand my problem, but had a really good plan for me to try and help me improve my life. And so I think that's really part of what our vision and mission is to bring that ability to give a doctor enough time to hear you and help you solve your problem.
Exactly. Yeah. So I've been. We started the podcast in 2018 to cover all the scaling up leaders sharing their own scaling up lessons. And in last year, I was diagnosed with Hashimoto, and that's why I decided to cover also digital health scale-ups, and that's when we started this season about digital health. So I had my own experience on the patient side, and I have my own issues about having those 15-minute calls that you're talking about, and how important it is to have a doctor who really gets us, understands us, and is able even to get into the diagnosis stage. But there is also another side of the doctor that sometimes can get into a burnout state and needs to follow certain metrics and to be able to make the business model work. So what is your approach to be able to make the patient experience much better than in traditional healthcare, also an amazing doctor experience, and make the business model simultaneously?
It's definitely the needle to thread, isn't it?
Yeah.
I think the first thing I want to say about the providers, the doctors, is the doctors, they want to give you what you need and they want to spend the time with you. And structurally, I think it's set up that it's hard for them to do that. If you're an obstetrician, your number one priority is delivering babies. And so oftentimes they are called out to deliver a baby, and that makes their schedule run behind. So you're already kind of angry when you get into the office. So it's not a good patient experience, and it's not good for them because it's not fun to have people mad at you all day long because you're running behind. And so we don't do obstetrics, and we work with women through the first trimester, but we really focus on women's health and gynecology and the sexual health and menopause. So we don't have the distraction of being on call and called out. So that's one thing. We allow the providers enough time to have with the patient. And the first visit is an hour long. And then depending on what's next, sometimes they're not that long. But I think what your question was to me is, how do you do that? Like, how do you run the business with these long visits? And it's about product mix, really, from the business standpoint. And so our business also, we do surgical procedures in office. And so surgical procedures in office are good for everyone. They're good for the insurance companies because they cost less than a hospital. They're good for the patient because they have less exposure to all the things that you have in a hospital. And they're good for us because we get paid more for those than we would if we did them in the hospital. And so some of those higher dollar surgical procedures can help offset the lower dollar longer visits. And then in addition to that, we have a medical spa at HerMD, and we can offer patients some other things that just make them feel good. And so that also helps us with the whole picture of the product mix. Does that make sense?
Absolutely. I think that's the $1 million question, how to make a business model work in the digital health space, having all these ingredients in consideration, right? So that's really great. And I know that there is also a physical space that you are working on in order to make women feel even more comfortable when they are going into that space, to not feel that they are into those cold, let's say, clinics where they don't feel very comfortable at, let's say, in those words.
Well, it's funny. I have a pet peeve about when you walk into an office and there's a big piece of tape on the floor that says stand behind the line, and then there's plexiglass and you're on the phone, and nothing is as important as you are. Everything is more important than you are. So we try to change the game there. And so from the minute you walk in, the way it looks, the way it feels, even the way it smells nice. And the tone of voice that we try to talk to people in, it's not in a rushed, harsh tone. And so I think from the minute people walk in the door, we try to make them feel very welcome and safe. The finishes in the clinics feel more like a spa than a medical office. And the people are just kind and, welcoming, I would say. So
I love the spa concept. Sorry to interrupt. Yes.
No, that's fine.
Yeah, I think that the spa helps us to kind of understand the kind of concept that you are trying to deliver to your customers. Okay, and anything else that you'd like to share about that experience and a little bit the product, the business model, the vision of HerMD?
I thought there was one story that might be interesting to share. We recently had an event to talk about fibroids for women. And so fibroids are a problem that many women face. And we did an event, a Sonata event, which is about a new treatment that's available for this. And the interesting part about the story is Tanika Gray was there from the White Dress Project, and she and Dr. Javaid were discussing what I would say are very personal things that have happened around this area. And Tanique was telling her own story. And there was over 50 people in the room, and women started telling their stories, like very, like things you would just never talk about, like excessive bleeding and how it affected them, like not being included in family events. And I would just say it was a jaw-dropping experience for me to see what happens when you create an environment where people feel safe to share, and people were sharing in front of 50 strangers. And so it was very touching to me that this is an opportunity to really affect change and give women an opportunity to feel safe talking about these things that have been taboo. And I have to tell you, Mike, even since I joined the company, now I'm not a doctor, just to be clear, my phone has been ringing off the hook with people saying, wow, do you think they can help me with this? Can they help me with that? I don't know where to go. I don't know. Like who, you mentioned something to me about, herbal supplements. And so people are just like seeking, like, where can I get like real evidence-based medicine that is covered by my insurance? And so I think that's, I didn't mention that earlier, but we do accept insurance. We're not a concierge product. We're trying to make it affordable for women to get this care. So
that's a good point. Yeah.
So I don't know, I guess that's the thing I would maybe end with on that topic, is just the idea that creating that safe space is so powerful.
Right. So, and in terms of the scaling up lessons, of course, you are joining now at the Series A stage. And it has been a 10 million Series A round that HerMD has raised. So what's next, and what are some of your lessons learned scaling up companies?
I think companies and scaling companies are all about people to begin with. And so the first lesson is trying to learn about who you have on the team and what their gifts and gaps are. And so everybody has things, I call them superpowers. Dr. Javed calls them their gifts, but everybody has things that they're really, really good at. And so as you scale, if you can find ways to put people in the position to leverage those skills, it's very powerful. So I think the first thing is really assessing the team, figuring out the superpowers. The second thing is, where do you have gaps? So there's always gaps somewhere. And so how do you fill the gaps? What's the best way to get that done? So that's really the second thing. And then laying out a plan to do that. And then I think the third thing is the product itself. And to me, the product is the things we talked about, like what does the patient consumer experience look like? And in products, there's often a focus in one area, and then there's other areas that are not as good. And I find in healthcare, usually the visit itself is where we all focus. But then what happens after the visit, or like my prescription doesn't work, or I can't schedule. And so when we can perfect that end to end and get that all dialed in, I think then you're ready to go. So it's really, the product, the people, the product, and those things really can get you ready to go fast.
Love it. Yeah, I think we have discussed this a lot on the show, and also with the CEOs that I advise, the importance of radical focus and of a clear ICP. And in your case, the ICP is super, super clear, right? So who you are trying to serve. At this moment, are you present in how many states? Already in all states? How is your expansion strategy being executed and planned?
Well, we've seen patients from 30 states already. Patients have come to us. And so now we're trying to bring HerMD to them in the other states. So we're in 2 states. We've just secured a location in a 3rd state, and we're actively looking for real estate in additional locations, trying to find an East Coast location, expanding our Midwest presence. And so that's really our focus, along with telemed. The compact makes it, you're familiar, I'm sure, with the telehealth compact. It makes it a little bit easier to go broader more quickly for telehealth. So we're working on that as well. So we'll be doing a parallel path of expanding telehealth across the country. That'll happen more quickly than the brick and mortar expansion. Exactly. But we'll be doing them at the same time.
More scalable in that perspective, right?
Absolutely.
And I agree with you. The team is all, of course, it's the starting up stage. It's all about the founding team. It's the scaling up stage, about the, as I like to call, the leadership team 1.0, 2.0, 3.0, because of course we need different skills for different stages of growth. At this stage, what is the head count of HerMD? Just to have an idea of, or more or less.
We're less than 50, but we're growing quickly.
Of course, especially now, it will accelerate, right, with the A round.
Definitely accelerate, and bringing in some key roles. Like you just mentioned something, I think that's important to realize is as you scale and get bigger, the skill sets change. And so we've hired some key positions. Like, for example, we brought in someone who has a lot of experience just building retail clinics and selecting real estate. And so when you bring in that skill, it really allows you to go a lot quicker. But that skill wasn't there because that wasn't the focus at that point in time.
Got it. And finally, so I like to talk about radical focus, the team and culture, of course. And finally, something that I think that I almost listened on your words, which is the execution machine. So having the rhythms in place, having the OKRs, and huge clarity on what is the narrative and the meat and the long term in terms of the vision of the company, and that everyone can own that vision and make it happen on a daily basis. And I would say that we a lot of times we had hosted also other times professional CEOs, but what is the approach of a professional CEO that comes into a VC backed company at this stage? What are some of the lessons that other professional CEOs can learn from your experience with HerMD so far?
I think one of the things I think that is really helpful when you come into a new company is usually there's a lot of fear right away. So everybody's going to be afraid that you'll fire them. It's just natural. It's a change thing. And so what I like to do is just focus on the work. And so we often sit down, and we did this at HerMD the very first week. We laid out what is all the work and kind of buckets of work in each category. What are the finance work, HR, clinical? And it starts to, number one, it helps people realize it isn't about my job. It's just like I'm doing a lot of work. Where are the gaps? Where am I not getting it done? And then we made a list of things that we are not going to do. And so you mentioned focus. I think it's just as important to focus on what you are not going to do as what you are going to do. And so we did that. We put some things below the line, and then it creates this natural transition of organizational architecture. Because when you lay out all the work with no names, then there's really no worry about power struggles. And then you say, oh, now it makes sense to me that this person shouldn't have these 6 things, and it doesn't feel bad. And so that would be my advice, is just focus on the work and create a structure to understand what it is. And then it comes more naturally to then re-architect the team over the first few months, because there'll be changes when you come into a new series of funding.
Absolutely. Something important that you said, and it should be important to share with other leaders that are listening to the show, is that in such a fast growth environment, it is impossible to promise to people that there will not be changes. What we can promise is that we will have changes, and a lot of changes. And I think it's really important for people to understand that when they are joining a VC backed company, there is a lot of change, and we need to embrace change as part of the game, right? As part of the rules.
Well, I want to share one quick story about that. I had great advice once from a mentor of mine, and he told a story about his son who had a friend who was 6 foot tall in a basketball team, and he always wanted to be a point guard. And his name was Jeremy. We always called it the Jeremy story. And so Jeremy, we said, we need you to be center. And he said, but I don't want to be center. I want to be point guard. And the coach said, well, do you want to win, the game, or do you want to be point guard? So when you're on a team, you have to be willing to do what's best for the team to win the game. Does that make sense?
Absolutely.
And so I just love the Jeremy story. Put me in, coach, put me where you need me to go. And so we try to talk about that. We want the team to win. So.
And I think it's great to go through those transitions. It creates a lot of emotional and mental resilience and makes us more prepared to upcoming challenges in life and in business, right? And when we go to other kind of businesses, it seems that nothing happens. So then I think that the ones who are in the VC-backed world then will miss also the vibe and the enthusiasm and the ups and downs, of course, of the journey.
You have to be a certain person, right, to do that kind of work. I call it white knuckle sailing. You have to like the heavy wind.
Exactly. And I think that the point that we're also sharing is, besides there will be a lot of change, we need to be able to make that change, respecting the culture and the values and doing well those transitions, right? Again, it's not about promising that things will be always perfect, because nobody can promise that, but that we will treat people with respect, that we will try to live as much as possible our values and our culture, and that we will give opportunities for people to grow and to be promoted, or to follow their own personal purpose in other VC-backed companies, and to always be a member of the success of the company that they have represented, kind of once HerMD, forever HerMD. I love that motto, because a lot of people also leave to other ventures and then feel super identified with what they did at their previous careers and are amazing fans outside of the company.
I agree 100%.
Great. So let's go into the last segment, which is a lot of fun, kind of quick questions and quick answers. Maybe it's a bit early to ask you if you would have a coffee with yourself at the beginning of your journey with HerMD. What advice would you offer to your younger self? So maybe I will allow you to select a certain moment in time in the past to kind of have the opportunity to have a coffee with you and give your younger self an advice.
I would say don't be a tornado. I would say I've always been very focused on execution and getting things done, but my younger self was a bit of a tornado. And so have a little bit of awareness of the effect of your actions on everyone else. And everyone may not want to move quite as quickly as you do. So my advice would be just watch how people are reacting a little bit more closely to my younger self.
And what are you the most proud of on your career journey so far?
I've had the opportunity, I think, to really build things that make a difference to people. And so I think that's probably what I'm most proud of. At Zoom Care, we did a product called Zoom Super that was a same-day emergency clinic. And it was so rewarding to see how every single patient would say thank you. And the same here at HerMD, I think, we're doing things that make such a difference for people. So that's probably the most rewarding part. Mission driven.
Exactly, definitely. I've also helped multiple scale-ups to scale, and something that I most value nowadays is mission-driven ventures and strong purposes. And as I said, that's one of the reasons that we are doing this season with you. So, worst advice ever received?
I won't believe this, but I had a math teacher, once tell me that I had learned enough. And I was very interested in math and I wanted to do something more complex. I was a little bored and he said, "You've learned enough." So that was not good advice. You've never learned enough. And I learn every day. And at the end of every week, I try to write down what I learned this week, because we just never stop learning.
Absolutely. Favorite book?
There's so many books that I like. There's one called Start With Why. And I just like that there's a TED talk also on Start With Why. And I think just teaching people about understanding the why.
Absolutely.
Give people context as to why you're asking them to do things. I think it really matters.
Kind of also, I think that's a great leadership trait, is to align the why of the individual, almost the life plan with the business plan and the career plan. I think that as leaders, we can help our teams to feel more fulfilled and to leverage their potential. Favorite movie or series?
Well, it's kind of an oldie but a goodie, but I love Top Gun. It was such a great movie. It had so many elements of everything in it. Romance, it had the action. It was just a great movie about relationships. But I also, my more recent one is I am a fan of Yellowstone. Just love Yellowstone and the scenery and Kevin Costner. It's a great, great show.
Right. Awesome. And is there anything else that I should have asked you, or any other considerations that you'd like to make before we go, Kathy?
Well, I think you've touched on most of the things. I just, I'm really excited to be a part of this team and this group of women who started the team. The only other thing I guess I would say is one of my big revelations in being part of this team is just how supportive the culture is. And as you build companies, I think trying to have a culture that supports each other and recognizes when maybe somebody's having a bad day and to just support them through that. It's just very unique, this culture that we're creating here at this company. And I'm so excited about it.
That's awesome. And so I wish you all the best in your journey with HerMD, and you are more than invited to come back into the show to share your journey and your lessons learned going into the B round. I'm sure it will keep being a success. So thanks so much for making the time to be with us today.
Well, I appreciate being here. Thanks, Mike.
And to our community, thanks for being there. As you see, we keep bringing you the best of the best to make your life a little bit easier scaling up. It's never easy, but it is also a lot of fun. See you soon and keep scaling.